Hey everybody, so here is our therapy approach presentation. We had Mia's background and description. So Mia is 9 years old. She was born full term without any complications. She lives with her parents, her two younger siblings, and attends public school. Mia has no history of hearing loss, neurological issues, or trauma. Her early development followed typical milestones, so her motive, cognitive, and social emotional skills uh, followed as need be as what am I
Normal.
trying to say? As normal as her age. And Mia has a strong vocabulary skills and shows no significant cognitive issues. However,
So Mia's parents sought out a speech language evaluation after noticing that she was struggling with her grammar, particularly in her use of verb tenses, pluralization, and possessive forms. Her parents reported that she began speaking later than her peers, but she caught up pretty quickly in vocabulary by the age of 3. By the age of 4, she was speaking incomplete sentences, engaging in conversations, but her speech and writing often contained grammatical errors. By the age of 6, they noticed that she was able to understand complex sentences and verbally communicate well, but she often made frequent errors in verb tenses, plural nouns, possessives, and subject verb agreement when it came to her writing skills.
so as we said, Mia was referred to a speech language pathologist for an evaluation due to concerns about her grammatical errors and her morphosyntactic structures, so her written and spoken language, despite having a strong vocabulary skill and no significant cognitive issues. Uh, an assessment was given to her. It was the OWLS 2, and it showed the different areas in which she performed. So Mia was diagnosed with morphological language disorder, a specific language impairment that affects her ability to use grammatical morphemes correctly. So her verb tense, her plurals, her possessives, and subject verb agreement. Mia's difficulty with morpho syntactic structures in her speech and writing has been hindering her academic process and social interactions. Uh, her academic struggles were largely related to her difficulty with grammar. She was able to express herself clearly in informal conversation, but often received low marks for written language assignments due to her errors in that morphology.
Areas to address. So, Mia's receptive language and phonological articulation skills were demonstrated to be intact and appropriate for her age. So, her difficulties were more specific to morpho syntax errors, so a combination of morphology and syntax. Her written language mirrored the errors that were observed in her spoken language. So she struggles with written sentences that involve tense, pluralization, and possessive forms. Her writing, again, has frequent errors in grammar, and her primary difficulty is in morphological structures.
So, with those morphological structures, she has trouble with her verb tense errors. So she frequently augmented or incorrectly used verb tense markers. So, an example with this would be like she might say, she walked to the store instead of she walked to the store, or I goed to the park instead of saying I went to the park. She had pluralization where Mia consistently had difficulty with plural nouns, often omitting the plural s suffix or generalization rules. That being, two dog instead of there's two dogs, or instead of saying there's mice, she would say mouses. Um, she had trouble with her possessive forms, so Mia struggled to correctly use possessive s suffix, saying like that's Sarah book instead of that's Sarah's book. Her verb subject agreement. She frequently made errors with subject verb agreement, particularly in the third person singular verbs, such as uh, she go to the park instead of she goes to the park, or singular verbs such as she go to the park instead of uh, yeah, she goes to the park. Um, and her sentence structure, although Mia was able to form complex sentences, her errors in morphology affected her overall grammatically of her sentences. So she would often omit auxiliary verbs, that being, she playing outside instead of she is playing outside.
So, our evidence based therapy approach is called enhanced conversational recast therapy. So, this involves providing immediate corrections in conversation without interrupting the flow of communication. So, the goal is to help the child internalize correct grammar through repeated exposure and practice. So, since Mia can express herself clearly, but she struggles with grammatical structure, ERCT provides a way to address these errors within meaningful conversation without overwhelming her. So, an example of this would be Mia says, I go to the park. And then the clinician would be like, oh, you went to the park? That sounds fun. So, essentially, what you're doing is the therapist repeats back what they say, but they correct the errors. So it kind of models the correct usage for her. And then she can just essentially, copy it back the correct way.
All right. And another evidence-based theory that just piggybacks off of UCRT is individual versus small group treatment or morphological errors. So this is a study that examines the effects of ECRT and the morphological errors. And so what this basically does is just it's a study that assesses the effectiveness of this treatment just in a group setting or with partners, and the possible benefits of exposing a child to his or her partner's troubles in that morphology target. So basically, like I said, this basically just exposes Mia to others who are going through the same type of therapy, building those connections, making her feel, she's not alone in this process, and others aren't alone. They're all in there with her together, and this will also help, her social skills with speech and writing, if it had any exercises in writing. And just being aware of what we're saying and how to do those morphological errors, and just make sure that we don't have any, and just be aware of how we say how we say things.
So my activity is called story recast. So basically, what you would do is you would select a story, you would read it out loud to her, and emphasize the correct target morphemes and the way that you say them correctly. And then Mia would retell the story in her own words. And then as she retells the story, you listen to her grammatical mistakes, and then you kind of essentially repeat it back, but in a correct way. So, an example, Mia would say, "Will the wolf blow down the house?" And then the clinician would be like, "Yes, the wolf blew down the house. He blew it down so fast." And you'd emphasize the correct usage of the past tense verb of blow. So it'd be blew.
And for my activity, I figured we could do a sorting game. So just do a fun game that tackles the morphemes that she has troubles with. Uh, So say we can sort words. Maybe it could be like in a picture book, or it could be with paper cutouts, or it could be with actual toys. Um, that way she's engaging with those, and doing that thinking with how she wants to say certain words. And you do this uh, that with words that focus with the past tense of ed, or the plural s of morphine. Uh, so, for example, would be, say we had a uh, we're playing pretend and we have ice cream. the clinician could ask her a question and just be like, "Oh no, did my ice cream melt or did it or melted?" You know, or do some kind of phrasing where like it allows her to think about what those past tense forms are. Or, we could have toys, or say we have like little figurines or anything of like some dogs, and just ask her some questions that allows her to creatively think. To be like, is there two dog or is there two dogs? And have her think about the structure of those sentences.
So, social cultural factors. So, parental involvement. Mia's parents are actively involved in her development. This is evidenced by their approach of getting her evaluated by a speech language pathologist. Cultural norms. So, some cultures place a high emphasis on storytelling or verbal communications. So, her morphological difficulties could lead to misunderstandings in some social situations if her culture does place a high emphasis on those things. Academic context. So Mia attends a public school where the curriculum fits the mainstream social and cultural norms. So teachers will play a key role in language acquisition and development. So speech language pathologists can collaborate with her teacher to make sure that what she's learning in speech coincides to with what she's learning in the classroom, so they can kind of tackle it from both ends, so that way she's getting double the, um, I guess, instruction, you could say, that she is supposed to get. Self perception and identity. So her grammatical errors may cause her to feel different from her peers, more specifically when she becomes more aware of them. So some cultures may discourage children from speaking openly about their difficulties, or they may even place a stigma on, receiving those services that she so desperately needs. So that could affect how she feels about therapy and just kind of like her attitude of like getting better. Like if there is a stigma surrounding it, then she's not going to want to go to therapy and she's not going to want to get better. But if there's no stigma, then she'll be like, oh, like I can go, and like she'll have more of a positive reaction to going to therapy and getting better and things like that. Thank
All right.
you.
Thank you so much. And then we have, of course, our works cited uh, right there on the next page and everything. So thank you all for everything. And we look forward to hearing about your projects.